The death of Hong Kong-born singer-songwriter Coco Lee has sparked an outpouring of condolences on social media by fellow artists. The 48-year-old attempted suicide on Sunday after suffering from depression for years, then never woke from a coma from that attempt. Coco Lee had an illustrious career in Mandopop. She went on to voice Mulan in the Disney animated film in 1998 and was also the first Chinese American to perform at the Oscars. Lee's sisters shared that she was battling depression for some time before finally caving into it over the weekend. This episode is drawing renewed attention to mental health and depression. In particular, Singapore reported 476 suicides in 2022. That's the highest in 20 years, according to the Samaritans of Singapore. We're joined in the studios now by a guest who's recovering from depression. She wants to be known only as Miss K. She's joining us on the line. And also here in the studio, we're joined by Dr. Jared Ng. He's Senior Consultant and Medical Director at Connections Mind Health. Dr. Ng, let me begin with you. Those numbers, the 476 number that we just reported there in 2022, the highest in 20 years.
Yep.
Why is this happening?
Suicide is actually a really complex topic, and we need to discuss it sensitively. There is no just one reason why someone would take their own life. It is really a confluence of many risk factors. I think the most well-known would be that of a mental illness that is undiagnosed, untreated, or undertreated. I think there is also the effect of social isolation and loneliness, which we learned a lot about during the pandemic. And it's not just restricted to the elderly. I think young people we see in our practice also suffers from the effect, the despair of being isolated. Certainly, people go through life events like a marital breakdown, financial stress, bereavement. I think all these are risk factors, but we have to understand that risk factors makes it more likely that a suicide will happen, but they're not the direct cause. It's really a very complex interaction between them. So there's no one cause, but it's something that we need to look into further.
As complex as it is, Dr. Ng, what are the challenges that healthcare professionals like yourself face in actually being able to do what you need to do to help? I mean, especially with prevention as well, since this is a disease, an illness, which is not easily seen. I mean, people suffer from what is known as clinical depression.
That's right.
As an example, you can't tell that a person is depressed just by even necessarily speaking to them or looking at them.
Yeah, so I must say, first of all, that I think we have done a lot in terms of increasing mental health literacy and reducing the level of stigma, and certainly much more than when I was a young doctor. But then the challenge is that we've reduced stigma with all these people coming for help. We need to have a corresponding increase in the resources to manage them. Imagine someone having the courage to finally decide to see a psychiatrist, only to know that the waiting time is 3 to 4 months later. I think that can be quite disheartening and make them lose faith in getting better. So I think we need to increase the resources to treat them. With regards to suicide prevention, we have to recognize that it's really not just about mental health care. It is really about the efforts of the entire system, families, friends, to look out for one another. I'll give you a good example. We know that significant proportions of suicide are impulsive in nature. Patients have told us, studies have told us that the duration between someone making a decision to take their life and actually committing the act could be as short as 5 to 10 minutes. Actually, that means that the person closest to them, like friends and family, would be the one to be able to reach out to them. Hotlines, like what SOS does, will also be very important for them. And that is why families and friends, we focus a lot of efforts to teach them, to empower them, and really to tell them what are the warning signs to look out for.
A very sobering reality and picture that you paint there, Dr. Ng. Ms. K, let's bring you in on the conversation now, and I want to thank you for joining us this evening. You are recovering from depression. Can you share more with us about your experience?
Yeah, sure. I think my relationship with depression is quite complex. It occurred on the years of 2015 to 2017 as well, to 2017 to 2021. I went through bullying continuously through my secondary school years. even after voicing out to my teachers in my 11 kids, as well as my counselor. Unfortunately, in my case, they did not listen well. And so how I stopped the bullying is I made the decision to leave that school, as well as seek help from my mom to help me voice out in the constant bullying I faced for years. And then it also as well entered my life again. It continued from 17 to 20. These events affected me because I had difficulties in adjusting to society, and that resulted in me having social anxiety. And this is also another challenge I went through, but I managed to overcome with determination and lots of reassurance from myself, my family, and my friends. But as well, I think it took a lot of hard work and changing of my mindset to overcome that social anxiety.
Ms. Kay,
it happened. Yeah.
Ms. Kay, you've clearly been through a lot, and you knew that you knew that you needed help as well. You were saying that you did receive a lot of that help. Tell us what kinds of help you actually received.
I actually received through help through the SOS. I spoke with my counselor, and then talking about it really helped. Taking that first step to just talk about it and have an open mindset to learn about depression and how to tackle it. But I also learned as well that it's not just about the counselors playing the part. And going through it, I had to be proactive as well to try to take the first step and to be as open as possible about my experience with depression. Yeah.
Doctor, let me come back to you. How can we as a society actually do better? I mean, better recognize perhaps the symptoms of depression and what kinds of support we can actually provide our loved ones who might be going through it?
Okay, I think we have done more now. Like I said, I think it's really quite heartening to see even my daughter's school having a campaign to talk about mental wellness and about looking out for one another, talking about the importance of peer support. Other than looking out for your friends, your loved one, I think it's important to continue to be there. Even if they may decline your help to connect with them, they may decline your efforts to reach out and bring them for help. Always be there, because you never know what that little difference would do to them. Yeah.
Ms. Kay, I want to ask you the same question. After everything that you've been through, what can we do better as a society?
Hearing the doctor, I definitely agree with what he said. One of the key points I think that I want to bring up is, I think I agree with him, just being there, because I think people with depression, they tend to try to deal with it themselves, and they may portray it. I would say they don't mean it by declining that help. I think they just think that they just don't want to burden people with their problems, so they try to do it themselves. I think it's just a matter of just being there, just guiding them on how to take care of themselves, and just try to check in on them and just give them encouraging words like affirmation, things like that. They just need a friend. They just need someone to just brighten up their mind and on how they feel, and to make them feel like they're really not alone. Yeah.
And no one is alone. Ms. Kay, thank you so much, and we wish you all the very best on your recovery journey. And thank you to both of you. That was Dr. Jared Ng there, Senior Consultant and Medical Director at Connections Mind Health. Thank you. And Ms. Kay there, sharing more about her experience and recovery from depression. Now, for our viewers, if you need to talk to someone, or you know of someone who is perhaps suicidal, you may call the SOS hotline or email them at the address on your screen right now.